I'm going to tell you something about ambulatory BP monitoring. Now, ambulatory BP monitoring is basically a test to evaluate patients who come with borderline blood pressure or patients who say that they have got a fluctuating blood pressure even when they are on medicines or without medicines. So many times what happens is when a patient is coming to a doctor, his blood pressure rises because of anxiety, and whenever the blood pressure is measured at any other place, he finds that it is normal. Now this is established phenomena. It's a known phenomena which is known as white coat hypertension, which is basically because of the anxiety that a person has when he meets a doctor. Now the way to evaluate these patients who have got borderline blood pressure or blood pressure which is high only when they are seen by the doctor, or blood pressure which is fluctuating, is by ambulatory BP. Now basically what ambulatory BP is, that just like the blood pressure machine, we connect a BP recording machine to the patient, and then the patient is asked to go home with that machine. The machine is programmed in such a way that it can record the blood pressure once in every 15 minutes or 30 minutes or 1 hour, depending on how frequently we want it to be recorded. And then it keeps measuring the blood pressure and it is recorded within the machine. Now, while this machine is attached, the patient goes about with his routine work. He goes to his office, he sleeps, and all the while his blood pressure is continuously monitored. And when the patient comes back to the hospital or the clinic the next day, then we analyze all these recordings in our computer. Now this gives us a true picture of the patient's actual blood pressure when he is out of the hospital and when he is carrying out his daily routine activities. So naturally it will give us a true picture of the fluctuation of whether the patient has got a high blood pressure or not. Now it is totally painless procedure, absolutely nothing. It is just like recording blood pressure in a normal clinic, and it has been found in multiple trials to be quite accurate and reliable to detect blood pressure. Now I'll just show you that small device. It's a pretty small device. This is how it looks. It's a very small one, and along with that we have a blood pressure cuff. So it is very simple. This is attached to the patient's arm, and then this gets attached to this machine, which is just around 100 grams or so, only around 100 grams. And after that we have a small strap by which the patient just hangs it next to his body, and he can go around with this for the next 24 hours. So as you can see, things have become much easier now, and this is probably the best way to diagnose patients who have got a borderline blood pressure or patients who say that their blood pressure is widely fluctuating.